Hey guys, welcome back to my channel. My name is Roni and I am a Nigerian but currently living in Canada with my husband. I am a health, lifestyle and family vlogger. I am a registered nurse and a midwife. So today I'll be talking to us about breast cancer. But before we move into the main topic for today, let us just briefly know about the breast. The breast is one of two prominences that is located on the upper ventral region of the torso. Both the male and the female both have breasts. And during development, both the male and the female develop breasts from the same embryological tissue. But during puberty, the female tends to develop breasts with the help of the estrogen. In conjunction with the growth hormone, they develop breasts. The breast overlies the pectoralis major muscle, which can extend from the second rib to the sixth rib in front of the rib cage. And the breast can extend to the clavicle and the sternum. The main function of the breast is for beautification and lactation. The suspensory copper ligaments helps the breast to be firm and keep its shape. The breast has like 14 to 18 irregular lactiferous lobes, which help during breastfeeding, and because they all converge at the nipple. The breast, when looking at it physically, you can see the skin, you can see the areola, you can see the nipple. Then internally, the breast has the lobes and ducts. Now, talking about breast cancer, what are cancers? Cancer is a hereditary disease. And when I say hereditary, I mean that the DNA that makes up the gene of the affected cell is damaged. And breast cancer is no exception. So when the DNA that makes up the gene of this affected cell is damaged, it leads to excessive multiplication and growth of abnormal cells. So when these cells grow abnormally and multiply excessively, they tend to, or even when they don't die off when they're supposed to die off, they tend to grow and multiply and have the capability of spreading to other parts of the body via the blood or the lymphatic tissues. The tumor or the breast tumors are categorized into two types, and it all depends on where the tumor is located. To understand better where the location of this tumor can be, we will use a grape to demonstrate. So let's just imagine that these just situated. These are the lobes or the lobules, and this is the duct. So let's just say during breastfeeding, so when this contains the milk, so when the baby suckles the breast and the brain is notified or signified, okay, we are ready to breastfeed, or we are ready to breastfeed the baby, they are slightly squeezed, thereby pushing milk to the ducts and then coming out from the nipple. So these are basically how the lobes or the lobules and the ducts look like inside of us. So there is in situ carcinoma. In situ, when you hear in situ, what does it mean? It means that something is at a place. So when the tumor is still converged or is still inside the lobes and the duct, or the lobules and the duct, it is known as the in situ carcinoma. It has not spread to any other part of the breast or even the body. It's still within the lobes and the ducts. And basically the treatment for this is through surgery, radiation, and hormone therapy can be recommended after surgery. The second one is infiltrating carcinoma. It's now invasive. This is the one that we consider as the cancer. It's more dangerous, it's more serious. When you hear the word infiltrating, what comes to your mind? Spread, right? Yes. Now the tumor has spread to other parts of the breast tissue. It has gone beyond the lobes and the ducts, and this is what we know as metastasis. So the treatment of this is governed by three principles or factors: the size of the tumor, the extent of spread, and the organs involved. A pathologist conducts a biopsy to determine the type or the size or all the information needed about the tumor removed. Basically, a cancer cell is detected if the patient feels lump on the breast, goes to hospital for examination, or when the doctor is conducting a mammography and detects an abnormal cell in the woman's breast. So when is usually advised, when somebody is told, or when a woman is told that she has breast cancer, it's advised that you ask your doctor questions. We know that it can be very, very overwhelming, but it's necessary that you ask your doctor questions so that he can explain to you what the whole treatment process is all about, so that you can even have the opportunity to even choose how you want to be treated. Because some people go on and say, okay, I want total mastectomy, just remove everything because I don't want any reoccurrence and everything. You ask your doctor questions, they explain everything to you. Don't just say, oh, because the person has cancer and that's just it, just take it. Just cool down, listen to your doctor, ask questions. Anyone you don't understand or any procedure you don't understand, ask questions. So doing surgery, for this case, there is something that is called the sentinel lymph node procedure that is carried out. This procedure is just when the lymph node around the armpit where the surgery is conducted is taken to find out the particular lymph node that has the probability of getting metastasized in future. So if the pathologist carries out the test, does this sentinel lymph node analysis or procedure, and finds out that, oh, there is a metastatic component in this tumor, in this cell, or in this anything, they go on, take off all the lymph nodes. But if they don't find, they can leave it. This is very, very helpful. So after the surgery, the pathologists get into work. They find more, try to find more information about this thing that they removed from about this tumor. They try to analyze, examine, carry out more exams to actually find out. At the end of the day, the pathologists gather the information and write a report, and it's called the pathologist report. This report is very, very essential and important because it helps to know the extent at which this or to know the staging of this cancer, and again to know the kind of post-op care to be given to this patient, and chemotherapy that is needed if necessary. So that takes us to knowing about the stages of cancer. There are about 5 stages of cancer: stage 0, stage 1, stage 2, stage 3, stage 4. Staging simply means the extent to which this disease has gone. So, coming to stage 0. Stage 0 is the non-invasive stage. There is no evidence that the cancer tumor has spread to other surrounding breast tissues. Is still confined into the lobes and the ducts. Then stage 1 is known as the early invasive stage. Here, when the tumor is measured, it is not more than 2 centimeters in diameter, and there is no evidence that it has spread to other parts of the breast tissues. The next one is stage 2. Stage 2 is called the invasive breast cancer, and is subcategorized into 2A and 2B. In 2A, when the tumor is measured, it is not more than 2 centimeters in diameter, and it has spread to the lymph nodes under the arm. Or it is still within 2 to 5 centimeters in diameter and has not spread to other lymph nodes. In 2B, the tumor, when measured, is within 2 to 5 centimeters and has spread to other lymph nodes. Or it is still less than 5 centimeters and has not spread to other lymph nodes. Going to stage 3. Stage 3 can also be subcategorized into 3A, 3B, and 3C. In 3A, there are 2 scenarios that can happen in 3A, which are: the first one, that the tumor, when measured, can be like 2 to 5 centimeters in diameter and has spread to other parts of the breast tissues and has formed clumps. While in the second scenario is still similar to the first one, but the only thing now is that it is more than 5 centimeters and has also spread to other parts and has equally formed clumps. Getting to 3B, getting to stage 3B. Stage 3B is that it can be of any size, but it has spread to other parts. The tumor can be of any size and has spread to other parts of the breast tissues, and now there is swelling around the breast, and you can find lumps on the breast. In stage 3C, here the tumor can be of any size too and can spread to the lymph nodes above or below the clavicle. The clavicle is this bone here, this very bone here. So it has spread above or below the clavicle and even the chest wall. Then getting to the 4th and final stage, it is known as the distant metastatic cancer. Here it has spread to all the lymph nodes, all the parts of the body, breast tissues, and now goes on to spread to every other body parts, and even the organs here can be affected. At this point, the cancer must have eaten deep into the patient. So here, I think that with this staging, you must have understood that early detection is just the savior to cancer, because when one detects early, it can help to salvage any damage that is now remaining, that anything that is remaining, it can help. because the more the tumors increase, or the more it increases, the more dangerous it becomes. So early detection matters a lot. Then furthermore, I would like to teach us, or if there's no other thing that you took out from this video, I would like you to always remember the 5 W's of breast cancer, which are: 1. Who develops breast cancer? 2. When does breast cancer develop? 3. Why does some people develop breast cancer? 4. Where do breast cancer occur? 5. What do patients that have breast cancer present with? So, going through it, the first one: who develops breast cancer? Breast cancer can be developed by both men and women. Both of them can have breast cancer because they both have breasts. So study shows that 99.2% of women have breast cancer, while 0.8% of men can have breast cancer. The second one: when does breast cancer develop? The highest occurrence of breast cancer, the highest diagnosis of occurrence of breast cancer, has been between the ages of 50 to 70. But that does not mean that someone will just stay and just wait till they are 50 to start testing. No. Once you have attained the age of maybe from 40 or 45 to 55 years, it's advised that you go for your mammography every year, at least once a year. You get yourself tested, get yourself checked to know if there are unnecessary, unwanted cells that are growing abnormally in the person's breast. 3. Why do certain people have breast cancer? Because in as much as breast cancer is a genetic disease, there are still some other risk factors that predisposes one into having breast cancer, like exposure of estrogen throughout one's life. Like example, early menarche, that's early menstruation, late menopause, late pregnancy, no pregnancy at all, and hormone replacement therapy. All these things can predispose one into having breast cancer. The fourth one is: where does breast cancer occur? Like we initially stated, that the types of tumors that are affected in the breast are situated in the lobes and the ducts. And when it's in the lobes and is still not invasive, it is known as lobal in situ carcinoma. And when it's in the duct, it is known as the ductal in situ carcinoma. But when it's now invasive and found in the lobes, it is known as lobal carcinoma. And when it's in the duct and invasive, it is known as ductal carcinoma. The last one: what do patients with breast cancer present with? The patients with breast cancer, their signs can either be asymptomatic or symptomatic. They can see it or they cannot see it. When it's asymptomatic, that's when the signs does not show. It's just when the patient goes to hospital and then a mammogram detects that there is an abnormal cell, that's when the patient knows. But when it's symptomatic, there are signs. That's when you now start seeing the engrossed breast or redness, soreness. There are lumps on the breasts. The person will start seeing physical changes, physical signs and symptoms of breast cancer. So that's just it for breast cancer. I hope you enjoyed this video. So if you did, I would say you should give it a thumbs up, and please subscribe to my channel, and please share the video, because you don't even know who might be interested to watch or who it might help. Then subscribe, turn on the notification button so that you'll be notified whenever I upload a new video. Thank you very much for watching. See you next time. Bye.